Good afternoon, everyone. Please come and take your seats so we can get started with our stories of fortitude. We got lots of room up front. This isn't a church. For those of you who don't know me, I'm Emmett, CEO of the Carol Emmott Foundation, and it's my distinct honor to introduce our curriculum director, Doug Riddle, who really is the architect of this symposium. Everyone knows that this is our fourth symposium. The first one was nameless, and at the first one, we named it for Christine Malcolm, who was our first executive director. Christine, I think, sent a note that's in the front of the program. She is in New Zealand, having the time of her life with her husband that she deserves. And so today we carry the tradition into our third year. And Doug, I welcome you to carry through this program. Thank you all.
Thank you, Anne. The symposium is one of the great opportunities we have to demonstrate something that's become a little slogan for us, which is that we're about changing the face of healthcare. And you're going to hear some great stories today about what that actually means in practice. A great slogan, let's start with that. If you take a little bit of time to do it, I think it makes some sense and helps us do that. We have 5 speakers today. It's probably cramming too many in, so I'm sort of whipping our team into shape here with this, so there'll be a certain amount of running between. This year we've also decided to not have respondents, and just to keep the focus on the stories of the fellows in particular that are doing that. It's been fun to have it both ways, to have the experience of some of our major healthcare leaders from across the country who have been able to kind of talk to us after hearing the stories of fellows about the significance of that and why this is important. Patient-centered healthcare is a great focus. We like that term. Everybody it sort of makes some sense to us. But fundamentally, patient-centered healthcare is about the person. There's a person involved if we're going to do that. And our fellows make clear in the stories they're going to tell you today about how health is always personal. Leaders of systems need to remember that healthcare takes place in the intersection of the stories of people. And it's such a privilege for me to be able to hear these stories, to work with our fellows as they prepare for something that's actually quite different than almost any other place. All of our fellows make presentations, places, great slides. We will have some pictures in slides. But this is very different because this is like the fellowship itself, the first fellowship year, and then the fellowship network, which has now grown and become so powerful, which is that it's about that bringing the whole person, the heart, the mind, the skills, the talent of all of these individuals. And so we don't focus so much on the fabulous things they're doing in their institutions. They'll talk about that too. But they're going to also talk about the personal choices that they make as leaders that in fact are transformative when we talk about our institutions and our systems. And I'm going to start with Nicki McCann, the fellowship class of 2021. Nicki's the Vice President of Provider and Payer Transformation at Johns Hopkins. And Nicki's story reminds us that patients are not always patient, and the people that we love are not always lovable. But everyone deserves to be seen as a whole person. Nicki McCann.
Thank you. So before I get started with my formal speech, I just have to tell a quick funny story. So I was upstairs practicing my speech, and I'm having sort of nothing short of a minor freak out, and I'm thinking, I can't do this. So, I text my husband, I'm freaking out, I don't know if I can do this. And I get the typical male response, Doug excluded, of course, which was, if you stand up there crying, you have a message to deliver, and if you stand up there crying, nobody's going to hear your message, so don't cry. So Here's to no crying, ladies, okay? Okay. So for some time, I was excited about the opportunity to talk about my impact project, a project that I am happy to report has become a reality. My impact project is referred to as GBRICS, the Greater Baltimore Regional Integrated Crisis System. GBRICS is a 17-hospital collaborative that partners with 4 local jurisdictions, including local government, emergency medical services, and police. This collaborative received $45 million in funding over 5 years to expand behavioral health crisis services through a regional call center and referral system, expanded and standardized mobile crisis teams, and same-day access to community-based treatment, all monitored and supported through a regional nonprofit structure. Originally, I thought the story to be told was how this collaborative came together, how we needed to create a buzz about the needs and possibility of expanding behavioral health crisis services in Baltimore, how I needed to align this vision with the funding opportunity and then build a coalition through existing and new relationships, how we needed to connect with the right political leaders to assure that they supported the long-term vision of this project. Bringing together 17 hospitals and 4 local jurisdictions to agree and support such a large project was no easy task. There were skeptics all around. I certainly thought this project was a story about fortitude. I was prepared to go on for 6, perhaps even 7 full minutes about how wonderful I am and how amazing my project had become, until I remembered that every woman in this room is wonderful with an amazing portfolio of work. That wouldn't be a very unique speech. As I thought more about fortitude, I realized that the story to be told about my impact project was not the how, it was the why. My father was and continues to be my inspiration. My father's experience is what drives my passion to ensure that people have access to the mental health and substance use treatment they need. My father struggled with alcohol use and heroin addiction throughout his life. His story is a story of fortitude, and our relationship is a story of fortitude. My experience both through and with him gave me the skills and strength I needed to make this project a reality. Through our shared experiences, I found passion, perseverance, and humility. And each of these skills were critical in making GBRICS happen. I believe that fortitude is not about just surviving a challenge, but learning from it and thriving from it. My father, Jack Sandusky, was a good man. More than a good man, he was a great man. My father was known for his incredible intelligence, his ability to connect with children, and his most precious gift, his ability to live life without judging others. Yet so many of his attributes were shadowed by his disease, his substance use disorder. My father's battle with addiction began in his early 20s. Started with heroin, switched to alcohol, returned to heroin until he finally found stability through a methadone program the last 20 years of his life. While I do not know all the details, I do know the general trajectory of his disease and the impact it had on his life. My mother left my father when I was around 1 because of his drug use. He dropped out of college with a 4.0, just a few credits shy of a degree. His drug use escalated to a point where my mother had to tell him, if you want to spend time with your daughter, you need to stop using. That was followed by an instance of overdose and hospitalization. These events led him to a moment where he found the fortitude that allowed him to move on, leaving his heroin use behind. When I was around 3, my father met a wonderful woman, Judy. He moved in with Judy and her 3 kids, Bruce, Eric, and Tracy. Life was good for Jack. He worked as a brick mason, a job he was good at, a job he took incredible pride in. His day started early and he was home in time to take care of the kids before Judy went to her job as a waitress in the evening shift. I was thrilled to be there on the weekends, where I had an instant family that I loved. My father was a great dad to me, to Bruce, Eric, and Tracy. But over time, his recreational drinking escalated. The occasional drinking too much on the weekend became the norm, and every drink led to drunk, and there was a drunk and a drink every night. His alcohol use escalated and continued for over a decade, until the point in time where Judy and my mom and those that loved my father decided enough was enough. There were too many times where he drove drunk with us kids, where his erratic drinking behavior had consequences: small house fires, missed work, forgotten or ignored responsibilities. My father was told, get help or you won't see your kids. My father went to Florida to live with his parents, where he entered a 12-step program. When he returned, his life and our lives were transformed. My father had this exceptional ability to live in the moment, to give you his undivided attention, to make every moment together feel special. And now that the alcohol was gone, we returned to being the subjects of his devotion. This stability continued for about 15 years, until my dad and Judy struggled in their relationship. They were under tremendous strain as they took in and cared for a dying family member. At some point through this struggle, he returned to heroin. The control that heroin had over his life was swift and absolute, and soon he lost everything. His job, his home. After months of lying, stealing, and cheating, Judy could take no more. She told him to leave. Throughout this time, my dad took up temporary residence with friends, with family, but everyone's conditions were always the same: no drug use. And with repeated violations, my father quickly wore out his welcome. As he struggled, he borrowed money from me, from others, to survive. He ended up in a house with other heroin users, and he found himself just existing, not living. My father sought help in a methadone program, one he successfully stayed in for about 20 years. He took this time to rebuild his life, to repair his relationships. He found a job driving a cab. Jen now knows why I don't use Uber. He found a place to live, and he reclaimed his status as everyone's trusted confidant. Throughout this time, my father lived an incredibly simple life. No car, no house, no bank account, no credit card, but he was happy. He was satisfied. His life was full. He had meaningful relationships with his family, his former partner, his kids, and his most precious part of his life, his grandkids, who were the center of his universe. My father's greatest display came at the end of his life. My father went most of his adult life without health insurance. He couldn't afford it. But with the Affordable Care Act, he had Medicaid. He found a primary care doctor. He got help quitting smoking. He was finally getting his health in order. Throughout this process, my father learned that his untreated hepatitis C, which he got from IV drug use, had progressed to untreatable liver cancer. The future became unknown, his life expectancy uncertain, but predicted to be short. My father received compassionate and incredible care at Johns Hopkins. For that, I am forever grateful. He lived for 2 more years where his quality of life was, by his standards, great. My father took this time to live his best life. He moved in with my family and me, where my son enjoyed his constant presence. While many of us under these circumstances might have developed a bucket list of places to go and see, my father had just one thing on his bucket list: to spend as much time with his 5 grandkids as he possibly could. And he did just that. Those kids were his everything. He had complete and total fulfillment. Then there was a defining point in time where my father decided his quality of life was gone. He was mini-golfing with the grandchildren, and he knew that it was his last outing with them. He would no longer have the physical strength. After that, my father declined quickly. Hospice came to the house, and we entered a new stage of uncertainty. The day after hospice came, my father had a good day. He had a great day. Meaningful interactions with friends and family, but the day was also filled with struggle. Moments when he could no longer feed himself. He could no longer be left alone. When the visitors had left and the house returned to quiet, my father said to me, "Today was a good day, and I want today to be my last day." While I was devastated, I had no choice but to respect his decision. My brothers and sister came over. The grandkids came over, and we spent our last night together. He took all of his pain medicine, and we said our goodbyes. I do not know how my father or anyone in his situation can find the courage to make the decision he did. But over the years, I've come to reflect on his lifelong struggle with substance use disorder, and I wonder if that somehow gave him the unwavering fortitude to embrace death on his own terms. He had lost everything at one point in time: his job, his home, the love of his life. Then he had to rebuild. He had to start over. And I think in that process, he gained insight into what really matters: meaningful relationships. When my father was new to the methadone program, he said to me, "You know what is the worst feeling? Knowing you found your place in life and lost it." He didn't regret the loss of his job, his car, his home. He regretted losing his place in a family he loved so dearly. But he didn't walk away with regret and disappointment. Instead, he took the time to rebuild and reconnect. He took time to remind everyone how truly special they were to him, and in return, they were reminded how special he was. It makes me wonder, as his cancer progressed and he knew the end was near, was it easier for him to come to the realization of what really mattered? His moment of clarity was concrete, it was definitive. When he could no longer participate in the meaningful relationships that mattered to him, quality of life was gone. He had no regrets. His was a life well lived. He spent his final moments embraced and supported by those that loved him most. My father displayed fortitude as he faced both his substance use disorder and his cancer. In his struggle, he found strength, meaning, and purpose in what really mattered: meaningful relationships. The other story of fortitude to be told here is that of our relationship. When I tell people about my father's past, of his struggles with substance use disorder, many are surprised to hear that we were so close, that our relationship was so meaningful. Somehow, even at an early age, I learned how to separate my father's disease from our relationship. I did not see his use of drugs or alcohol as a personal failure, nor did I see it as a reflection of our relationship or his love of me. My father adored me. I know that. And he also had a disease, substance use disorder. If my father had a lifelong struggle with diabetes or MS, would anybody question why we were so close, why we had such a meaningful relationship? No, they would not. My father had a disease, a disorder. That meant there were times when drugs and alcohol controlled him, controlled his life. Now, this is not to say that his disease did not have a meaningful impact on my life. I will also admit that there were difficult times. When drugs and alcohol consumed his life, my father lied, he stole, he cheated. There were times of neglect and recklessness, but I learned how to separate the man, my father, from the disease. At times, people who know my father's story come to me and they ask for advice, how to deal with somebody struggling with substance use disorder, someone using drugs or alcohol. I think every situation's different, every person's different, every relationship is different. But I do have one thing to offer: learn how to separate the person from the disease. Addiction can drive people to do wrong, hurtful, wildly inappropriate things, but know that when that happens, the disease is in control, not the person. If I had not learned how to separate my father from his disease, I would have missed out on an amazing bond with my father. He was my best friend, the person I could turn to in any situation for support and understanding. If I had not learned how to separate my father from his disease, my son would have missed the opportunity to live under the adoration of his grandfather. While there are times when life with my father was difficult, even painful beyond description, I gained the fortitude to look beyond the moment, past the disease, and to always recognize, love, and hold on to the person I knew and loved. For this, I have no regrets. In fact, for this, I'm incredibly proud. G-Bricks, the impact project that started this career, will always be a defining moment. It's just started the story, will always be a defining moment in my career. But it's my father's story that gave me the strength, the fortitude to find meaning and purpose from a painful memory. It is indeed my father's story and our relationship that has influenced who I am, my approach to life, both personally and professionally. For those of you who love someone who struggles with substance use disorder, for those who know the struggles themselves, I leave you with an image. My father is not remembered by his disease and the dark moments it brought on. Instead, he will always be remembered by his love and his deep and meaningful connection to those who loved him in return. Well, now part of my planned speech, I do feel a moment to reflect here and say why it was so important for me to tell this story. Is that I'm exhausted and tired of the perception of people with substance use disorder and mental illness, and the perception that it is a personal choice, that it is a weakness, that it is a lack of fortitude. And it's a disease. And so until we all start sharing our stories, we won't start thinking of it as a disease. So I just want to say thank you and share why it was so important for me to share his story.
Well, I'm so happy Nicki didn't cry. I'm sitting next to Tim Scholl, who's like, it's okay, Doug, it's gonna be all right. And of course, fellows from the third year and on are going, she didn't stay up there until all the applause had ended. I got it. Thank you.